We're talking about intrahepatic cholestasis of pregnancy. Are you in second half of your pregnancy and itching on your palms and soles is bothering you too much, but you're still not told your doctor about it? Well, as a high-risk obstetrician, I do fear this condition of the pregnancy, which is called as IHCP or intrahepatic cholestasis of pregnancy. I'm sure as a patient or her attendant, you may have often read this word on our prescriptions, but not too clear what this IHCP is all about. Let's talk about this in detail today. I'm Dr. Deepti Asthana, Senior Obstetrician in Fortis Hospital, Gurgaon and Director of Kalosa Clinic. Stay connected till the end to gain all the knowledge pertaining to this topic. Also subscribe my channel Kalosa Gynae to have regular updates about female reproductive health, and you can visit my websites drdeeptiasthana.com and kalosaasthetics.com. Now, so what is IHCP? Intrahepatic cholestasis of pregnancy is a liver disorder that occurs in pregnant women only. Now, cholestasis means stasis, because the release of the digestive fluid, which is called bile, from the liver cells gets affected. Now, as a result of this, bile builds up in the liver, impairing the liver function. Intrahepatic cholestasis of pregnancy usually becomes apparent in the third trimester of pregnancy, but it may start as early as from second trimester also sometimes. Now, it is usually caused due to hormones of the pregnancy, and bile flow returns to normal after delivery of the baby. There has been found some genetic predisposition also to IHCP. Now, what symptoms you should look for in IHCP? So, the moment itching starts, please inform your doctor and do not presume that this itching is because of some allergy. Now, other symptoms of IHCP can include dark urine, pale poo. Rarely you can have yellow skin or jaundice, which is very rare actually. Anorexia or loss of appetite can happen. You can feel fatigue. You can have pain in the right upper quadrant of abdomen, and there could be weight loss as a result of losing a lot of fat. There's also poor absorption of many nutrients. Now, why do we fear IHCP so much, and what harm does it do to our baby? Now, IHCP can cause problems for the unborn baby. This condition is associated with an increased risk of premature delivery, meconium staining of the amniotic fluid, and the most dreaded complication is stillbirth of the baby. Meconium aspiration before birth may result in difficult breathing after birth and may require NICU support. Now, how do we diagnose IHCP? Usually, your doctor is going to order liver function test. Raised enzymes with raised alkaline phosphatase suggest stasis of bile acids. A special test called as total bile acid is confirmatory, and this is done after 12 hours of fasting. Raised serum bile acid with a value of more than 10 confirms the diagnosis of IHCP. A value of 40 may be indicative of impending harm to the baby, and your doctor may plan early delivery in such cases. Now, what is the treatment of IHCP? It is commonly treated with ursodeoxycholic acid medicines, which relieve itching and increase bile flow. Your doctor may titrate the dose as per your serial LFT values. Now, daily fetal movement counts are the most important parameters which you have at home at this time and which should guide you about the well-being of the baby. Anytime you feel this decrease in the movement of the baby or change in the pattern of the movements, please report it to your doctor. Now, upper abdomen ultrasound scans may be used to look for abnormalities in the individual's liver. If a person is diagnosed with cholestasis of pregnancy, a doctor may also recommend more frequent ultrasound scans for the fetus. Now, this is to monitor fetal health and development on a regular basis. The doctor also may request regular non-stress tests to check how often the fetus moves in a given period and measure the fetal heart rate in relation to body movements. Now, if the LFT values fail to settle down in spite the maximum permissible dose of the tablet, you may be required to deliver early. A rise in total bile acid more than 40 should prompt you to become more alert and let your doctor decide the need for immediate delivery. Now, in my clinical practice, I've had many patients who fear more about preterm delivery in such situations, but they do not understand that this could also lead to impending intrauterine fetal demise. Believe me, if you have good NICU setup, please go by your doctor's decision to deliver early, and if it is not there, please shift to a better delivery center with good NICU setup. Saving your baby at this moment is the most important thing, nothing else. So to conclude, IHCP is one of the complications of pregnancy affecting the liver. Once diagnosed, be extra vigilant about baby's movements, growth, and any deterioration in LFT or bile acid should be immediately managed as per your doctor's advice. Thanks for staying together till the end and hope you like this information shared. Do subscribe my channel Kalosa Gynae for regular gynae updates and follow me on other medias like Instagram. Also visit my website drdeeptiasthana.com and kalosaesthetics.com. Till then, adios and keep enjoying your pregnancy.